The Medicare Part D program began in 2006 and consists of plans offered by private insurance companies approved by Medicare. Part D plans cover prescription drugs at a retail pharmacy with benefits that must be equal to or better than those defined by Medicare. Coverage options can and most likely will vary by insurer and plan type, as no two plans are exactly the same. All Part D plans have the same structure and follow 4 stages. They must meet a standard minimum benefit, which is determined by Center for Medicare and Medicaid Services every year. This includes deductibles, co-pays, and out-of-pocket limits associated with the plan's benefits. Each plan is approved by CMS on an annual basis. Let's use 2017 figures as an example. Stage 1 is the deductible period. The maximum deductible a plan can charge is $400, but some plans may be as low as $0. During this phase, the patient is paying the full retail cost of their medications. Once the deductible is met, the initial coverage period begins, which is stage 2. This is when the member pays a portion of the drug costs via a copay or coinsurance until the total of what the plan paid plus what the member paid equals $3,700. At that point, a person enters the 3rd stage called the coverage gap, also referred to as the donut hole. Not everyone will get to this stage since it is based on the full retail cost of their prescriptions, but those who do will pay a higher amount for their medications during this period. The coverage gap ends when the true out-of-pocket is reached, which equals $4,950. At that point, some financial relief comes in the way of stage 4, catastrophic coverage. This is when the member pays a maximum of 5% of the cost of their medications for the remainder of the year. This is an annual cycle, so it all resets and begins again for every January 1st. Each Part D drug plan has a list of covered drugs called a formulary, and medications not included on that list would not be covered. Medicare has its own list of excluded medications that would not be covered by any drug plan, which includes, but is not limited to, over-the-counter medications and medications purchased outside of the U.S. Part D plans decide which tier or category they classify drugs. Common tiers of drug classifications range generally from Tier 1 through Tier 5, the lower cost generic drugs being on the lower tiers and the higher cost name brand and specialty drugs being on higher tiers. Your cost share for a Tier 1 generic will be much lower than a Tier 4 non-preferred brand drug. There are a couple different ways you can opt into Part D prescription drug coverage. The first is by purchasing a standalone prescription drug plan. A person who has original Medicare only or original Medicare with Medicare supplement would go this route. The other option is choosing to receive your Part D benefits as part of a bundle in your Medicare Advantage plan. Most Advantage plans do include Part D coverage. A couple of important notes. You cannot purchase a standalone prescription drug plan and a Medicare Advantage plan at the same time. One will be canceled and it could leave a person without medical coverage. Also, please note that military retiree plans offer prescription coverage and it is considered credible coverage. A person could choose to have the prescriptions covered through the VA or even have both VA and Medicare Part D coverage. In order to be eligible for Part D, you must be enrolled in Medicare Part A and/or Part B, and you will be able to choose from plans available in your area. There is no underwriting. Each plan is different, and premiums will vary from plan to plan. For most, the cost of Medicare Part D is simply the premium of the drug plan you choose. But if your income is higher, there will be an additional amount to be paid depending on which income bracket you fall in. By the way, depending on your income level, you may qualify for Part D assistance. If you qualify, this assistance can reduce the amount a person pays for co-payments, co-insurance, and premiums, as well as eliminate the coverage gap in Part D plans and Part D penalties that may have accrued. Qualifying gives a person a special enrollment period to make plan changes throughout the year. We here at VibrantUSA are independent, trusted, and unbiased, and ready to serve you.